Welcome to OET Writing for Dentists. The writing test is 45 minutes long, and the first 5 minutes are spent reading the case study. You're not allowed to do anything but read. You cannot mark your case study. You must just sit and read through it. Now, here's some of the criteria that you need to observe. Your letter needs to have good grammar and spelling. They call this control of linguistic features. And you need to complete all the given tasks. Your letter needs to be logically written. It flows from one point to another, and make sure that it is relevant. Right, this relevancy is really, really important. Don't include irrelevant stuff. You need to keep your writing formal. Don't say, "Dear Jock, dear Bob." It's "Dear Doctor someone," or "Mr. Jones has come to see me about this and that." You need to follow correct letter format. It needs to be formal formatting, which means it needs to be dated, separate paragraphs, a reference line, and a suitable finishing paragraph. Try to avoid abbreviations. Don't use "don't," use "do not," that sort of thing. The tone of your letter is also very important, right? You have to make sure that the recipient that you're writing to understands what you're getting at in the letter. So if you're writing as a dentist to, say, an endodontist or some other specialist, it's not a problem because they will understand everything you're saying. But if you're writing to the parents of the child who is actually the patient, then those parents, don't expect them to understand various dental terminology, right? You can use it, but then you'd have to also add some explaining words, what it means. So between paragraphs, you need to leave a clear blank line, even if the next line's only got one word in it, right? Leave the rest of that line, then leave a clear blank line, and now start the next paragraph. The body or the content of your letter needs to be relevant, concise, tightly written, and accurate. Don't make it up. Here's a case study, Karen Sheehan. Now, at the end of all case studies, you will find a writing task. I've brought the writing task to the front here so that we can read that first. And using the information in the case notes, write a letter of referral to. Now, you're writing a letter of referral. You're referring this dental client on to an endodontist. And that's who you have to write to. Matthew Walters, endodontist, Stevenson Road, Footscray, Victoria. Right. Here comes the case study. This is why she came, because she wants endodontic treatment required on 237. And she had a myocardial infarction back in 2015, and she's allergic to penicillin. She takes aspirin every day. She's married, 2 kids. She's a social worker, and she smokes. So she's had quite a lot of dental history, lots of things happening. But today's examination shows that she's missing these teeth, 18, 28, 48. She's got 2 porcelain crowns. She's had root canals on these teeth, amalgam filling here, some MO amalgam, and occasional, I don't know what this means, OCC amalgam, and so on. That's today's examination, reveals all that. And over the years, she's had all this done, right? Now, I think these 2 are back to front. This March should come before that, all right? I'm sorry about this. March comes before May. So in March, she had scaling and cleaning done, and in May, she had 237. Don't know what all this means, but anyway, there's possibly a root canal treatment would be required. September, this 237 is having a lot of treatment. All right, in September, November, December, all this sort of stuff is going on all the time. Lots and lots and lots of information here, and you've got to refer to an endodontist. So the writing task: use the information in the case notes, write a letter of referral to Dr. Martha Walters, and refer this patient for care and management, right? Please take over the care and management of this patient. There's a reminder of what you've got to do. Look out for grammar, spelling, punctuation, da-da-da-da-da. So, previous candidate has written about this. Now here it is. This is a previous candidate's attempt, and she's written pretty well, but I don't think she's actually said in this letter, please take over the care and management of the patient. So if she has omitted from saying that, then she wouldn't be getting a pass with this letter, which is a shame because she writes very well. All right, I'll let you read that. So she just finishes up here. Please don't hesitate to contact me should you require further information. So it's actually a very bad ending. It should really be, please take over the care and management of this patient. Right. Here's a second case study, Jessica Wood. And again, the writing task I've put up the top here. Write a letter of referral to James Sunderland and ask for his assessment. Ask for his assessment of your dental treatment plan. Second thing you got to do, request he provide a prognosis regarding the chances of a successful income. Third thing you've got to do in the letter, outline the patient's dental history as well as her current problems. Make sure you do all that. So dental history, she's had scaling and cleaning and oral hygiene and fillings and extractions and bleaching and radiographs and all of this, right? Her medical history, she's actually had an appendix operation. Is that important? Don't think so. I would not include it. I would include this though. She's got a bit of an anxiety disorder and she currently takes Normicin pills one every night. I think the endodontist should know that. Endodontist or a periodontist. Anyway, we'll get to that. She works as a secretary, smokes 10 cigarettes a day, and today's examination shows that she's got all this. This is today's examination, right? So this is what you found out today about her, all this. Composite fillings, extracted wisdom teeth, root canal treatment in 35, amalgam filling and MO amalgam, and gum recessions happening on 44, 45, 46, and she's pretty hypersensitive to cold water. So over the years, she's been complaining about her yellowish teeth and dental hygiene and where else? Patient interested in bleaching teeth. She's had 2 wisdom teeth taken out. Right, next page. Wishes to have a white smile. She has started home bleaching treatment. So having these white teeth is pretty important to her. And she was advised about her gum receding on teeth 44, 45, 46. Was she over-brushing her teeth? Was that the problem? Trying to get them white. She was told avoid fizzy drinks with all that sugar. Okay, the patient noticed brown stains and she was told about the possible causes because she smokes and she drinks a lot of coffee, so the enamel is demineralizing. What else have we got here? Brown stains were removed by ultrasound. She can't eat cold food, so she probably balks at eating ice cream. And it was observed back in November that she had 4 millimetres of recession on teeth 44 and 45, which is quite a bit. Anyway, oral hygiene was instructed again and more scaling and cleaning, and she was recommended to use sensitive pro relief toothpaste. and she's still very sensitive to cold water. Now, it was discussed with her to cover her recession, to solve the recession problem with resin composite or gum grafting. So February, March, a couple of months later, the patient came back and she was interested in getting her recession treated with a gum graft. So she was advised at that point, quit smoking and avoid toothbrushing, and schedule an appointment to have a look at her again. When she came back to have again, she was told, I have stopped smoking. So you've got to write to this person here. He's a periodontist, not an endodontist, a periodontist, and ask his assessment of your dental treatment plan. And would he please provide a prognosis, a forecast of what's the chances of a successful outcome, right, if she has gum grafting done. Now, again, we've got a case study about this, a letter about this case study written by another candidate, and it's a pretty good letter. You'll see here there's a bit of grammar explanation going on here. This person had put in this article A, which was not required, because whitening treatment is definitely uncountable. There's a couple of ways to do whitening treatment. So it's a noun, but it's not. There's many ways to do this. You can't. So uncountable nouns do not require articles. So all you have to say here is Jessica had take home, not a take home, just Jessica had take home whitening treatment in 1998, which led to increased sensitivity to cold. Now, she has an unusual way of writing a G. This G is okay, but those two aren't. I'll leave you to read that. Here she goes again with these funny G's. Interested in gum grafting, I'd appreciate if you could assess her and discuss the prognosis of your specialist treatment. And then this candidate says right at the end, note Jessica suffers from anxiety disorder, for which she's on medication. That should just be singular, not that one there. Should you require, don't hesitate to contact me. Right. So there we have it. Please write the 2 letters. Send them to info@oetworkshop.com, and then me or someone else will have a look at them, review your work. Any corrections will be added to the letter and emailed back to you. That's all part and parcel of this service, okay? No extra charges. It's worth doing. Good luck.